Now, one of the toughest transitions for parents is when their children are preparing to head off to college. Now, Robin and I went through that with our boys, Jay and Jordan. Now, my next guest, Sunda, is going through that right now with her 17-year-old daughter, Aviva. Now, here's their story.
Now I got Satan and Lucifer, that's right, my teenage daughters.
I'm a comedian. I love making people laugh. Listen, I got this new joke.
My mom is infuriating at times, but she makes jokes to the point where it's just like, ugh.
What's so stressful? My daughter Aviva is just going crazy about which college she wants to go to.
I want to study musical theater, singing, acting, dancing, but applying for colleges is so nerve-wracking.
I'm more stressed about Aviva going to college than Aviva is.
Please, Mom.
One of the most challenging things is going to the doctor's office with my daughter.
She has this habit of speaking for me. Let me speak. I hate when people think they know me better than I know myself.
I'm not gonna quit being a mom now just because you go to college. She'll always be my baby. Can I get a kiss?
Nope.
Well, joining me now are Sunda, her daughter Aviva, and my good friend, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer. So thank you all for being here. Sunda, what are your greatest concerns about her leaving for college?
I guess you have an idea of how stressful it is thinking, is she going to be home tonight? Is she with the right friends? I want to be in that loop, you know?
Yeah. How do you feel about her being in the loop, as she says?
I'm sort of an independent person at times, but there's like certain times where I'd like to have business to myself.
Well, Dr. Freda, this situation is so typical. So where does this go?
As a mother of three, I know that, you know, one of the most challenging and exciting parts of being a parent is watching and helping your child be their own person. Going away to college is sometimes one of the most challenging parts of that transition. Sunda, I think you mentioned how concerned you were about making sure that Aviva really was ready to take care of the health aspects as she went away. And so the two of you can actually do some things together that would prepare Aviva to be more ready to take an active role in managing her own health and to know what to do when mama's not there.
What's the best place to start?
Making an appointment to get a wellness checkup, which teens should have annually. Make a list of the topics that you want to discuss. This will help you be organized when you get into the doctor's office, but it'll also help Aviva kind of raise some of the issues that she may want to talk about, that she has her own concerns about: physical development, sexual health, mental health. We have a teen health checklist on gethealthystayhealthy.com, which you can download. So talk to your teen about the behaviors that may put them at risk when they go away to school, like living in close quarters, sharing drinks, food, utensils, and makeup. These are all typical teen behaviors, but they're things that might put you at risk for exposure to things like the flu.
Yeah, and college students have an increased risk for meningococcal disease, right?
There is extra exposure. And you mentioned meningococcal disease, which is uncommon but serious. And it can attack without warning and spread quickly through the close quarters like in colleges. Now, this is a disease that causes inflammation of the protective membrane over the brain and the spinal cord, and it can also lead to serious blood infections. The early symptoms are very similar to the flu: fever, headache, nausea, and vomiting. So it's really important for parents and teens who are at risk to know those symptoms and to not ignore them.
Okay, so what can these two do now to help protect Aviva before she takes off for college?
There's a set of recommended immunizations that you could start with. And these may help protect against influenza or the flu and meningitis, which we just talked about, as well as other things. Hepatitis B, human papillomavirus, and tetanus. And talk to your doctor about the vaccination schedule at the schools that Aviva is applying to, because these may vary from school to school and state to state. And it's also important that you do this while Aviva is a senior in high school, because most vaccines need to be given before you get to college, or they're given over a period of time.
And also mental health is important to discuss.
Absolutely. Don't shy away from thinking about the mental health aspects. And then there's some things that you can do to help maintain your balance and reduce stress. So you want to get, good sleep, want to eat healthily, keep your exercise program up. You want to establish a good social network. And then last but not least, the things to avoid: tobacco, drugs, and alcohol. I also want to suggest that you establish resources for helping you manage your health. So in addition to your family doctor, you want to think about the pharmacist, a nurse, the team at the Student Health Center. And you want to get to know these resources before you need them. Mom, you might want to help identify an online health information resource that is trusted so that you know where to go when you have questions. You can start with gethealthystayhealthy.com, and there's information there that'll help you stay healthy as you go away to college and beyond. And of course, while you're there, you can sign up for the newsletter.
All right, I want to thank all of my guests today, especially Dr. Freda Lewis-Hall.